Hey guys, it's Michael again. In this video, we're going to talk about how to be able to market your company correctly and to avoid any, violations, and at the very same time is keeping it where your company is safe from potential harms of any liability in regards to the government going after you or even some lawsuits as well. And so we're going to mainly be talking about some of the anti-kickback status and also the Starks laws that a lot of home health agencies should be aware, and even home care companies should actually also be aware of, okay? So let's go ahead and get started. Now, when we are creating new methods to be able to bring in new patients, to bring in more referral sources, it's a big challenge, right, for an agency. It's a big thing that we face. And every single agency out there faces this problem, whether you're hospice, home health, or home care company. And current trends is making things more, more difficult to be able to find better and more referral sources. It's getting really competitive out there, right? CMS has actually estimated that currently there are more than 10,000 home health agencies that are servicing the Medicare population. That's right, 10,000. And also depends on what state you're currently in. There are states where there are 2,000 home health agencies. Okay? So most are small, most are local, mom and pop, and some are even regional providers or national providers. And so we have to understand that. And so a lot of places are small who doesn't have enough money, not enough promotion materials, not enough money. They're not able to hire good branding managers to make their business even better. So know this, as agencies are looking to more innovative ways to be able to introduce their company, their services, their products to the community, as well as other providers and of course the patients and referral sources. It is very important to be able to know and consider the legal parameters that is imposed in the home health marketing strategies. Marketing of your home health company, your services, is highly regulated both by federal as well as state governments, okay? Prohibiting many marketing practices that are normally common in other industries, in other day-to-day businesses, but it's not in the healthcare industry. So, a lot of experienced healthcare providers, for example, they may seem absurd to suggest marketing healthcare services in the same way that maybe your local car dealership out there, your local grocery out there, your regular insurance companies or donut shops or coffee shops, that way they create specials and a lot of different events in the area. But even these experienced marketers may not even be aware of the ever-changing prohibitions on the marketing on what is the right things of doing things in this industry of ours. So what we're doing in this particular section in this video is to be able to help you guys navigate to the variety of different laws, the variety of different procedures on how to be able to stay compliant. We're going to be talking to you guys about the anti-kickback statutes, talk to you guys about the Starks law, HIPAA, as well as other state laws that you should know, okay? These are such an important thing that we want to be able to make sure we share with you guys. So let's talk about the anti-kickback statutes. So let's talk about it, right? What is anti-kickback? The Anti-Kickback Act is a criminal statute in which it prohibits purposely offering or accepting payments from Medicare, Medicaid, or any other government reimbursable health care referrals. So the Department of Health and Human Services, their Office of Inspector General, was given this power around 1987 to actually exclude providers from Medicare, right, for violating the statutes. Civil money penalties may also be assessed to these agencies that violates this. Now, it is, how would you say, very common knowledge that providers are not able or should not be paying anyone for referring a patient for services, right? But the statute that was created goes pretty much beyond the simple paying someone for a referral. The anti-kickback statute prohibits any arrangement between a provider and another person or party where the main purpose of this arrangement is to be able to induce or to be able to gain and acquire a referral. To add to that, a payment under the anti-kickback statute does not include just money, not just money, not just the money or writing a check. It also includes anything of monetary value. So a person or potential anti-kickback violation may exist and in a lot of different arrangements. Or let's say, for example, a contact between a provider and a third party. That can also happen. Now, the statute does provide what we call safe harbors. Safe harbors from enforcements for arrangements that serve legitimate business purposes, okay? The safe harbor exemptions include, for space rentals, equipment rentals, agreements for employment, person and management services, for example, discount arrangements, referral arrangements, and even investment interests. The safe harbor does not give providers discretion to enter into legitimate business agreements, but rather they pretty much outlines the detailed criteria for specific agreements. The violation of Anti-Kickback Act can be found in different marketing techniques as well as agreements outside the marketing scopes. We want you to be careful on what you do when you create these type of agreements and making sure that you discuss this with your law team. Okay? Some examples would be, completing discharge, planning for hospital patients or sponsoring a luncheons for physicians. That's right. When physicians or their staff ask you to come in and bring lunch, you can be violating the anti-kickback statute. So you don't want to be able to make sure that you look into the spending. You want to look into that, what you're doing. At the same time as you can even violate it if you're entering into a contract with another agency just to perform physical therapy services on people, what we call sliding fee scales, pretty much based on the amount of services that is rendered. So not like the Starks Law, the anti-kickback statutes, the regulations, okay, does not allow for, some minimal exceptions. Therefore, even giving physicians donuts during routine visits can be considered a violation. So to avoid these, home health agencies like yours should establish a bright line rule that marketers are never and should not give anything of high value when marketing their services. To add to that, when home health agencies enter into an arrangement with third parties, whether it be for leasing the space, the therapy services, for referrals, or for billing services, they should always draft what we call a written agreement. Don't just use your word as your bond. Actually have a written agreement that fits in a safe harbor exception of the anti-kickback statute. Okay? Pay attention to that. I want to make sure that you guys are aware of this. Let's move on to the Starks Law. Okay? The Starks Law 2 actually prohibits physicians from referring Medicare patients to an entity with which the physician or the member of the physician's immediate family has any financial relationships. Unless, of course, there's an exception that is there. When we talk about financial relationship, it includes owners or a compensation relationship where a designated healthcare provider. So a compensation arrangement is pretty much any arrangement which can involve remuneration between that physician and a designated entity, between that physician and another company or another person. Unlike the anti-kickback statute, the Starks Law is not a criminal law and only pertains to referral relationships between the providers and the physicians. The Starks Law does not govern a provider's relationship with the hospitals, with the suppliers, or other non-physician professionals. The regulation has clearly established restrictions that upon the physicians referring patients to entities in which that physician has a particular interest. Now, however, Starks 2 becomes an issue in several other situations. So let's talk about those situations. It is commonly an issue in developing an advisory board or contracting with as a medical director or with a medical director, for example. So if physicians have a direct line with potential patients and direct care, right? And drafting arrangements or agreements with physicians, there's a lot of caution you need to be able to get into that. There's a variety of different rules that can actually apply with that physician being an employee of an agency, or with that physician is an independent contractor of a home health agency. So let's talk about being a medical director, for example. A medical director agreement can actually fall in the management and services exceptions if that agreement is within writing and if the compensation or what they're going to get is set in an advanced fair market value. Remember that, a fair market value. Now, however, just like any exceptions under the Starks Law, in order for an arrangement between a physician and a facility, a home health agency, to be actually lawful, this arrangement must also be in accordance with the anti-kickback statutes. Some payment arrangements set in advance at a fair market value may actually not in the boundaries of the law. If one of the purposes of that arrangement is to actually induce referrals from that physician, that's going to get you guys in trouble. So you have to pay attention to all this. Now let's move on to HIPAA violations. Let's talk about HIPAA. As a home health agency, as a person working in the healthcare industry, the HIPAA law has been bounced on so many times. So let's discuss, what is HIPAA? HIPAA, the Health Insurance Portability and Accountability Act, governs the privacy and protecting patient information. From now on, when we discuss this, let's just talk and call this PHI. This provides need to be careful in releasing protected information, health information, to third parties. Using PHI for marketing purposes and offering services to patients, releasing this information for treatment and payment related purposes is an exception to HIPAA. But be cautious about this. Providers should always enter into a business associate agreement with independent contractors when releasing PHI to make sure that the contractor is adhering to the HIPAA regulations. To add to that, providers should have a system that is in place that will guarantee and ensure that there is a minimum amount of information that is actually disclosed. When using protective health information for marketing purposes, providers should gain or obtain the authorization from the patient, from that patient, not just the family member, from that patient, which expresses, acknowledges, and agrees that disclosing of information is for marketing purposes, and it says that if the provider is receiving conversation for the disclosure, you have to notify that. Last thing, HIPAA prohibits offering or transferring that a person knows or should know likely induces a beneficiary to order or receive a covered item or services from a particular provider or even a supplier. Both Stark's law as well as the anti-kickback law, the statutes that they are, addresses inducements given by providers to non-patients. Not like the Stark's law and the anti-kickback statutes, HIPAA will literally address offering inducements directly to patients. Examples of HIPAA violations would be offering a free complimentary transportation to patients, completing pre-surgery screening, and also free introductory therapy sessions. In a special advisory meeting, for example, the OIG announced that a cap applicable to all patient gifts, which is $10 and no more than $50 annually. Did you hear that? Let me repeat that. The OIG announced that there is a cap applicable to all patient gifts, which is $10 each event and no more than $50 worth annually. So you guys have to pay attention to all these, because this is very much an important thing. There's been a lot of facilities that have actually violated these and got in trouble. Just HIPAA violations alone can cost you so much. Imagine if you get caught doing any kickbacks. That right there has actually, we've seen an influx of a lot of nurses and healthcare providers and physicians going to jail just because of that. So make sure you guys pay close attention and keep on watching more of our videos, because that's our goal, is to give you guys as much information as possible so that you guys can have a successful agency.